let's discuss treatment. We have a graphic that shows some of the options that patients have. So let's spend some time talking about each of these, Dr. Martinez. First, we have behavioral treatments and what they are and how do they help people with incontinence.
So I love this list right here because I think it's in a great order of our treatment algorithm. In other words, we start off with the least invasive to most invasive. The first being behavioral treatments. Second would be medications. Then we go into electrical nerve stimulation, which we'll go over a little bit more about that.
Right.
Bulking agents, and then of course, last one would be surgery.
Surgery is always the last option.
Again, it depends on the patient, depends on the problem. We try to keep the more invasive therapies towards the end, but again, you have to take, each patient's different. And so the behavioral treatments, you were asking what exactly is that? This is what we call pelvic floor therapy. In addition to that, we do other lifestyle changes, such as limiting the amount of fluid you may be drinking, especially before you go to bed, if your issue is more incontinence at night. The pelvic floor therapy is rehabilitation for the pelvic floor. It's the pelvic floor is one of the most complex joints, we'll call it, in the body.
Right.
You can imagine how many muscles are working. And we spend the first 4 years of our lives how to use those muscles in a socially acceptable manner. How do we void? How do we maintain continence? And the rest of our lives we're ruining that, and that's for different reasons, whether it be life stresses, work, we're holding our urine for long periods of time, we've had surgery, women go through childbirth, you name it.
Right.
And so pelvic floor therapy is part taking it back to the basics. In addition to that, you injure your knee, you go to rehab, right?
Right.
Why wouldn't you do any sort of rehabilitation if you're having issues with your pelvic floor? Whether when you're having issues with your bladder, when you're having issues with your urethra, et cetera, et cetera. So that's where that one comes from.